Young children and teenagers are commonly affected with tonsillitis. Tonsillitis is a common problem in young children and teenagers. Now we discuss what is tonsillitis. Tonsillitis is an acute inflammation of tonsil. There is a small gland in the pharyngeal pouch which is called tonsil. When tonsils become inflamed, it's called tonsillitis. There are so many etiological factors for tonsillitis. Now we discuss about the causes or etiology of tonsil. First of all, herpes simplex virus infection, Epstein-Barr virus infection, cytomegalovirus, other herpes viruses, adenovirus, and measles viruses. Is tonsillitis free from bacterial infection? No. Bacteria causes 15 to 30% of pharyngotonsillitis. Tonsillitis may be two types, acute or chronic. Chronic tonsillitis is less dangerous, but acute tonsillitis is more painful and dangerous. Now we go through the signs and symptoms of tonsillitis. Individuals with acute tonsillitis present with the following: fever, sore throat, foul breath, dysphagia, which means difficulty in swallowing, odynophagia, painful swallowing, tender cervical lymph node. Airway obstruction may be manifest as mouth breathing, snoring, sleep disordered breathing, etc. A dangerous condition may arise from tonsillitis, such as peritonsillar abscesses, which is characterized by severe throat, fever, drooling, foul breathing, trismus, difficulty in opening the mouth, altered voice quality, the hot potato voice. Now, how can we diagnose the tonsillitis? Tonsillitis is almost truly a clinical diagnosis, but some investigations can be helpful. We are not going to the investigations. We are going now to the management of tonsillitis. Treatment of acute tonsillitis is largely supportive and focuses on maintaining adequate hydration and calorie intake and controlling pain and fever. Corticosteroid may shorten the duration of fever and pharyngitis in cases of infectious mononucleosis. Tonsillectomy is indicated for the individuals who have experienced the following. So, when tonsillectomy is required, more than 6 episodes of bacterial tonsillitis or pharyngitis, 5 episodes of bacterial pharyngitis in consecutive 2 years, 3 or more infections of the tonsil or adenoid per year for 3 years, chronic or recurrent tonsillitis. Now we discuss about the medications. Medications that are used to manage tonsillitis include antibiotic, anti-inflammatory agents such as corticosteroids, antipyretic such as paracetamol, ibuprofen, and analgesics, aspirin, dexabuprofen. Adult doses for the treatment of tonsillitis: amoxicillin 500 mg 12 hourly for 10 days or 200 to 500 mg 8 hourly for 10 days. Cefuroxime 250 mg per oral once daily for 10 days. Phenoxymethyl-penicillin 500 mg per oral 12 hourly for 10 days. Pediatric doses: phenoxymethyl-penicillin 25 to 50 mg per kg per day in 4 divided doses for 10 days. Amoxicillin 50 mg per kg per day in 2 to 3 doses for 10 days. Amoxicillin plus clavulanic acid 500 mg per oral 12 hourly for 10 days. Cefuroxime 10 mg per kg per oral 12 hourly for 4 to 10 days. Adult doses: If the patient or if the person has allergy to penicillin, azithromycin 500 mg per oral daily for 5 days, or clarithromycin 250 mg per oral 12 hourly for 10 days. Clarithromycin for children 20 mg per kg per day in 3 divided doses for 10 days. Adult levofloxacin 500 mg per oral once daily for 7 days. Pediatric doses if the small child has allergy to penicillin, azithromycin 12 mg per kg per oral daily for 5 days. Clarithromycin 250 mg per oral 12 hourly for 10 days. Clindamycin 20 mg per kg per day per oral 3 divided dose for 10 days. There are some home remedies required to treat tonsillitis. Regularly give hot water soak with salt to the throat. This medication will help the pain and fever to subside. This will cure your person and children very rapidly. Please subscribe our channel if you like the video. Thank you.